Kawalia is also here. Sam, are you there?
Yes, I'm here.
Okay. Okay, great. So we'll be live on Facebook. I think we're already live on Facebook. So, welcome to the 60 Days of Winnow, which is simply a healthcare talk series which focuses on mental health. And we sincerely apologize for starting late today. We had a bit of a technical failure. And so today's topic is basically on still on mental health, sponsored by Performance Insurance Brokers. And today's topic is about bipolar mood disorder and mania. The past weeks we talked about depression. We also talked about burnout at work. Remember last week, on the past weeks, we've had Dr. Francisca Walia, who's been amazing on the show. And I'm so happy today to have a different guest, a different doctor who's also specializing in mental health. And this is Dr. Lulembo. Dr. Lulembo, welcome to the show. And this is a time for you to educate us more on mental health, because these are topics that we are not talking about, and we want to create audience for them, and also create a platform where people are able to express themselves and talk about these issues. The floor is all yours.
Okay. Hi, Tavo. How are you?
I'm
Thank,
good.
thank you for the introduction.
You're
Okay.
welcome.
Like you mentioned, Tavo, we're talking about mood disorders, eh? So when we talk about mood disorders, basically we're talking about illnesses or mental illnesses that have to do with the emotional state of somebody. So it's mainly to do with the emotional state. So you can imagine how common mood disorders must be. So I'm glad you've talked about depression already. So today we'll focus on bipolar mood disorder. So what is bipolar mood disorder? I think not many people have heard about it. So bipolar mood disorder is basically a mental illness that I'm going to try to be as plain as possible so that everybody can understand me, eh, Tabo? So
Definitely.
yes, so basically it's a mental illness where you have a fluctuation or a severe swing of moods from one pole or one extreme to the next extreme. So one extreme is extreme excitement and irritability to the next extreme, which is depression. Yeah, so that extreme excitement that we're talking about, that's what we define as mania. So because we talked about depression and last week, today I think we'll be focusing more on mania. Yeah. So we talk about, so when we talk about mania, what do we mean? So basically, this is where you have, Tabo, this is where you have a person whose mood is abnormally high. It's an abnormally high mood. Yes, abnormally high mood, elevated. We use the word elated, but what we mean is the person will be very excited, more than usual, more than what is normal. They will feel like they've got so much energy. They'll be extra happy. Sometimes they're not always extra happy. Sometimes they can be irritable as well. You just notice they're very angry, and also like there's for you to say somebody has mania, they'll present for they'll have to have these symptoms for about a week, okay, and these symptoms will have to be present most of the day, and they're very excited, easily irritated. They have so much energy. They feel they don't need to sleep. Their thoughts are racing. That's basically the picture of a manic patient. Yeah,
Okay.
and that's like you said, one pole of bipolar. Yes, and you mentioned that this is the aspect that we'll focus on for today and next week. Yeah. So basically, the more details will be the types of mania. There's mixed state where you have a patient who has both that excitement and also depression at the same time happening within the same 1 week period. That you have the days when they're very excited and then the days they have depressive mood. Then there's also what we call hypomania. This is where it's similar to mania, but it's less. When we say hypo, we mean less. It's less severe. So usually you find that a lot of these cases go unnoticed because these patients are usually not severe enough for them to be hospitalized. So for us to say, oh, people will just think, this is a person who's just excited, or that's just how they are. So these are patients who have symptoms similar to mania, but these symptoms won't last 1 week. They'll be shorter for about 4 days, and also they'll be less severe. They'll be able to go about their life, work, and do everything that they're doing. Only that people will notice that they're only sleeping 3 hours, You ask them, why are you only sleeping 3 hours? No, I feel like I've got so much energy. I don't need to sleep. Things like that. You just see a few changes that will make it see there's something wrong here. And then, those are different types of mania. Then we'll also like to talk about the causes, the risk factors of mania. I'm not sure whether we can talk about it this week or maybe we can talk about that next week.
Okay, maybe before you move on to the other different types, something that I think we haven't taken the time to understand is how to identify somebody who has bipolar. Because when you say I'm extremely happy and I'm extremely sad at certain times, I'm trying to think, how do you identify somebody who's bipolar? Because then is it easy to tell? Like, how extreme is extreme? Or is it only just a medical doctor who can tell to say this one is bipolar? And I think we've had certain well-known people who have bipolar. Like this year, I found out that Kanye West is actually has bipolar. And so I'm trying to think, when does it perform the best? Is it when he's on his high? Is it when he's on his low? So maybe you could just help us understand on us on the other side, how you can identify somebody who has bipolar. Maybe there could be somebody out there, you just think they're so moody, they're always happy, they're always this, and yet the person actually has bipolar. So how can we tell?
Okay, that's a very good question. You've given a very valid point. It's actually quite difficult for people to tell that somebody has bipolar. I think maybe let me give you some of the symptoms that you can understand. So we'll start, it's not just the mood. There are a lot of other things that go into saying somebody is bipolar, because almost everyone has some mood swings from time to time. Yeah, but for you to actually say somebody is bipolar, there are certain things that have to be there. Firstly, yes, the mood has to be excited, like very excited. You find the person is, the best word I can use is frenzy. They're so excited, their eyes are open, they're just, that extreme excitement. People think, are they high? That's just a bit of excitement, a lot of excitement. And then also what's important is that they have exaggerated self-esteem. So that's another thing. They have what we call grandiosity. They think they're more important than they are. For example, if somebody starts calling themselves God, you know that, okay, there's a problem there, you see? Yeah, so you know that that's not normal. Yes, we all have mood swings, but when you start calling yourself, when you start thinking you've got the powers of God, or when you start feeling like you are the president, or you are a high figure, you've got special powers, that's one of the things that make you start wondering, okay, are we dealing with a bipolar patient? Also, reduced need to sleep. Usually, most of us will sleep a number of hours, 7-8 hours a night, but you find a bipolar patient who will feel the need to only sleep a few hours. They'll tell you, I'm actually okay. I just need to sleep 2-3 hours and I'm fine. I have so much to do. Then you find that they are so energetic, they will feel like they can wake up at 04 for no reason to just go running, because they just have that much energy, or they've got just so much, they have so much goal-directed energy. Like you just see them pacing up and down, all those things, even how they speak. They speak very, very fast. I speak fast, but no, much faster. They speak very, very fast. You can tell if somebody has racing thoughts. You can tell when you're speaking to somebody with racing thoughts. It's like one thing after another. So things like that, all those things make you think, okay, maybe this is somebody with bipolar mood disorder, because you've seen all those traits are supposed to be are there. And then also another aspect is you find that a lot of bipolar patients involve themselves in reckless behavior. You find that they end up having illicit sexual practices, drinking excessively, just certain reckless behavior, spending money excessively. So all those things put together make you think of that. So I'm not saying it's easy to make the diagnosis. For example, if somebody feels like their mood fluctuations are a bit extreme, then I think it's best that they get professional help. That's the part where they can get professional help. You get seen by a doctor, preferably a psychiatrist, who get your symptoms, take your history, and will assess and see, okay, are we dealing with a bipolar patient? And also, we also have to consider that bipolar has different types. There are some that are not as severe, so those can be easily missed, you see? Okay. So if you feel like, let's say you've got a relative who has changed their behavior, you notice some abnormalities, it's best to just seek help so that we can help assess, because like you said, it is a bit difficult to come up with that.
I've noticed how most of the symptoms that you've talked about now are from people who are of an elderly age. So let's say now in children, how is one able to tell for those that are not yet talking? Are there certain things that they do? Do they cry excessively? How can you pick bipolar in children?
Okay, so bipolar in children is quite difficult because I think we can talk more about in adolescents as opposed to in younger children. It's not as common in younger children. So more for adults, if you think of let's say adolescents, they usually, by adolescents I mean teenagers, so that age group, it's usually they're irritable, you know. I know a lot of teenagers are irritable, but a bit more than usual. If you see some changes that you see a bit abnormal, you just seek help. I think that's the best way I can put it. Because it's difficult even for medical personnel to tell the difference between bipolar in a certain age group and other mental illnesses, because they have an overlap in younger age groups. Yes.
Okay. Interesting. So then from a medical point of view, what are the causes of bipolar?
Okay, so there are many factors that come into play when you talk about causes of bipolar. I will talk about three main ones. I'll talk about the genetic aspect, okay, the environmental aspect, and I'll talk about, let's say, the biological aspect. So the genetic aspect, this is more of like a family history. You actually find that a lot of patients that are bipolar or have mood disorders have a first-degree relative or a close relative that is also bipolar or also has a mood disorder. Studies actually show that if one parent has bipolar, it means that there's a 10 to 25% chance of their children, or one of their children having bipolar. So there's that aspect, of family history, the genetic aspect. So some people are more genetically predisposed than others. Okay. Then secondly, there's the environmental aspect. So environmental aspect includes certain things that happen, certain traumatic life events, you know, certain stressors in life, loss of a job, loss of a loved one, rape, just different traumatic life events and stressors really. Yeah. And then for the biological, I'll call it the biological aspect. We'll talk about there are different chemicals in the brain. I'll use the word chemicals that are different levels in patients that have bipolar. Yeah, I think that's the best way I can put it. So all those factors come into play in causing bipolar mood disorder. Yeah.
Correct me if I'm wrong. Is somebody born with bipolar, or bipolar is it something that you can get even at an older age?
Yeah, you actually get it at an older age. It's like I've mentioned, there are a lot of factors that come into play. So there are some people who are genetically predisposed, meaning their genes are in such a way that there's a higher chance of them getting it. For example, not everybody with, let's say, a parent who is bipolar will have bipolar mood disorder, but the chances of children of parents who have bipolar mood disorder are higher that they can get bipolar mood disorder. I hope I'm making sense. There's that genetic predisposition, meaning that they have they can easily get it. So that genetic predisposition coupled with a certain life, all that person will need is a certain life trigger, a certain traumatic life event to happen, and those two combined will can end up causing the patient to have bipolar mood disorder. Yes.
My apologies. I lost my internet for a bit there. I'm so sorry.
No, it's okay. Yes.
Okay.
Yeah. Would you like me to repeat?
Yes, please. I think I lost you for like 2 minutes or so. My sincere apologies.
No, it's okay. Yes. I was saying that your question was, does that mean that people are born with it, right? Or they develop it later? Yes. So to answer your question, it will go back to what I had mentioned about the causes of bipolar mood disorder. So some people are genetically predisposed to getting bipolar mood disorder, meaning that they have a higher chance of getting it than other people. For example, people with a family history of it. It does not mean, I had mentioned, it does not mean that every person whose mother or father is bipolar will have bipolar mood disorder. No, it means they just have a higher chance of getting bipolar mood disorder. And then that genetic predisposition, coupled with other environmental factors, like let's say a traumatic life event, it ends up triggering the illness, and they end up with the bipolar mood disorder symptoms. So it's those things combined that actually cause it. So we can't say that people would definitely get bipolar. It's difficult to predict. Yeah. Hello? Hello?
Okay.
Yeah, so.
Maybe you can proceed to the other part of I think maybe you can continue to the other aspect of the presentation.
Okay. Okay. Bipolar, is it some?
Sorry?
I think her network may be bad because we seem to have lost her, but it looks like we're still live on Facebook. Then maybe I think, Dr. Lulambo, you could just go ahead maybe and talk about the other aspects of bipolar. Maybe you could go on and talk about so if one maybe is found to be bipolar, how do they go? How can they go about it maybe?
Okay, all right. Okay, thank you very much. Okay, yes. So we've talked about how you can recognize a person that has bipolar mood disorder. Especially, we've talked mainly about the excited part of it because we had earlier discussed the depressive part. So if you suspect that you have bipolar mood disorder, or you see that your mood is not okay, the best thing you could do is seek help. Like we had mentioned earlier, it's sometimes a difficult diagnosis to make. So the first thing you could do, the best thing for you to do is to seek help. If you're unsure, seek help. There are so many health facilities that you can easily go to, and you will be able to be aided. Both locally, government and private institutions will be able to help you. You can start from seeing a general doctor because we can start from seeing a general doctor, then they'll assess you. If they feel like you need to be referred to a psychiatrist, then you'll be referred to a psychiatrist because not all institutions have psychiatrists available. Yes. And then once you've been assessed by a mental health specialist, what happens is that they prepare a treatment plan for you. So depending on the severity of the mania, the treatment options are different. So we'll start with the psychological part. There'll be therapy that will be involved. If we feel like this patient is a manic patient, you'll go through different sessions of therapy to help you manage with stress, to help you cope with your condition, and also to help you understand your condition. Okay. Then apart from stress management and therapy, there's also the medicine part, the pharmacological part, which is the drugs part. There are certain drugs that if we see need, we give manic patients or we can say bipolar patients. So there are certain drugs that are called mood stabilizers. So remember in our courses, we had talked about how there are some chemicals in the brain that are not at the right levels. So what these mood stabilizers do is that they try and put the chemicals back into the right amounts. I think that's the best way I can put it. So
to create the balance, I guess.
Yes, to create that balance, exactly. So there are some medications that actually help patients create that balance of the chemicals in their brain. These are called mood stabilizers. There are so many different types of them. I won't go into the details of the types of medication. Yes, but there's the medical aspect. And then even so, if we put a patient on medication, they also have to go through the therapy, stress management, anger management, dealing with the diagnosis, just different types of psychotherapy is important. Yes. And then also there's a social management. it's important to engage our client with meaningful and purposeful activities, and also to make sure that their family is also supportive, because bipolar mood disorder and most mood disorders really are not quite difficult, not only on the patient themselves, but even on the family members as well. So they have all these are all the factors that we put into play when managing somebody with bipolar. So if you feel like there's a problem, seek help. There's so many facilities, both local and private. Yeah.
Okay. Interesting. I love how you've explained just the types and the causes of bipolar, because I think for people like me, I actually thought somebody is born with bipolar and then it progresses as they grow. I didn't know I could actually get it based on different factors. And you've talked about how an individual with bipolar is supposed to look after themselves and the major steps that they're supposed to take. So how about me, who's living with somebody who has bipolar? Is there some advice that you have? How do we handle such people? Because something I learned is they could also have multiple personalities. So how do you handle these personalities? And are you able to shed more light on how do these personalities switch? What would cause it? Is it being in a happy mood all of a sudden? What definitely causes this, and how can we help these people so that we be able to take care of them or handle them when they go at their extreme?
Okay, all right, I get your question. Okay, so like I mentioned, it's very difficult for, it's also not easy for relatives of patients that are bipolar. Okay, because it also stresses them, and sometimes these patients don't realize the effect that the illness has on their caretakers and their relatives. So the personalities. So I wouldn't I wouldn't call it multiple personalities. I wouldn't use the word multiple personalities.
I think that's what we've been exposed to in movies. In movies, we see it as multiple personalities. So that's the type of bipolar we think is actually there. Like this person all of a sudden is a geek, all of a sudden they are shallow. So I think it's great that you even shed more light on that.
Yeah, I get where you're coming from. I've heard that from a lot of people. So I think the reason people say that is because of the swing, because you have one person who is, you have the person who at one point is so excited, so happy, so much energy, and then you find a few months later down the line, they are depressed, they are suicidal, they've lost joy for life and zeal for life. So usually, like I mentioned, there are different types of bipolar. So usually that swinging doesn't happen like in one day, like, just 1 minute they're very happy, the next minute they're sad. Usually that doesn't happen unless we're talking about a mixed type of mania, but usually it's months in between. You understand? That's usually one episode, 10 months, go later, then the swing to the next pole happens, yes. So it's not as, yeah, like how it shows in movies, but it can happen like that though in a different type called mixed mania, yes. But I understand that it's difficult for the family. It's difficult for the family to understand as well and to cope. So what would help is when we deal with our patients who are bipolar, we do something that we call family therapy. So this is where we include the relatives of the patient with when they come for psychotherapy. We explain to them what the condition is. We also hear their struggles. So it's not just us concentrating on the patient. We also have family therapy so that everybody understands exactly what's going on. So the family therapy aspect is very important because it also helps the family members. That's also very important, yes. And also they need to encourage the patient. It's important that the person realizes that they've got an illness, because once you have that realization that you've got an illness, when people want to help you, it'll be easier for you to be helped. Even when family members tell you, take your medication, you'll be more willing to do so. So I think this is where counseling and therapy really, really help. We have something called family therapy that helps the family as much as possible. Yeah.
Interesting there, and I'm glad I'm glad I remember that point, because I always thought that's how bipolar works, and I guess this is the part where it differentiates somebody who has bipolar. Sorry, I think that's where we differentiate somebody who's just depressed, normal depression, and then there's that depression from bipolar. Because from what you have explained, bipolar could take even a series of a month or 2 weeks, and then depression could be once in a while. Maybe today you feel depressed, have some exercise, and then off you go, and you're okay. Um, uh, we have a question here, and she's asking to say, so when they go to the hospital, and when somebody goes to the hospital and is diagnosed with bipolar, for how long do they have to take the medication? Is it for life, or does it reach a point where they are no longer bipolar?
Okay, that's a very good question. Okay, so when somebody goes to the hospital, we decide that, okay, this person needs medication. We usually put them on medication for a very long period of time, okay? We do not specify how long, because sometimes it's possible to give somebody what is called a drug holiday, try them off the drugs for a little while. So, but usually the patient needs to be mentally prepared that they'll be taking this medication for a very long time, years. They have to mentally prepare themselves for that. Yes. I also wanted to comment on something.
Okay. And does yes, please.
Yes, on the depressed part, that's a whole different entity. That's a whole different. We had mentioned that about depressive mood and getting some exercise. That's a whole different entity. Depression is it's a whole different diagnosis, and it's got its own symptoms and diagnosis, and that's a whole big topic on its own. So I will not dwell into that part. I was talking about mania and depression in a bipolar patient. Yes. Okay. Just some clarity.
Okay. All right. That's interesting to note, and very interesting topic to actually learn. And from the previous chats that we've had with Dr. Walia, we've emphasized so much on how we don't talk about these issues. We don't talk about mental health, and something that you mentioned that may cause it is pain that is not dealt with due to maybe a loss of a loved one. And I like how even you've emphasized on the importance of going for therapy, having to talk through some of these emotions. What I wanted to ask again is, would bipolar lead to any other medical diseases? Is there any connection there?
Okay, all right. So what we see is a lot of bipolar mood disorder patients actually have end up with other mental health illnesses. For example, you find that a lot of bipolar mood disorder patients also have alcohol abuse as well, or let's say substance abuse in general. Alcohol, it can be cannabis, it can be heroin, but they tend to have they tend to have comorbid or added mental health problems, other mental health illnesses as well. Also, they're also associated with other mental health illnesses like anxiety disorders, and also eating disorders as well, associated with people with bipolar mood disorders. And then because you're also talking about general medical illnesses, because we had mentioned sometimes bipolar patients also tend to have reckless behavior because of the nature of the disease. So they can also practice illicit sexual practices. So that can also lead to HIV or hepatitis B. Yeah, so there are all those illnesses. Yeah.
And then earlier you had mentioned to say for certain bipolar people, some extremists would actually call themselves God. And I think maybe this is where our second question is coming from. So Nelly Nkoma is asking to say, so does it mean people with bipolar are likely to also have a high IQ? Is there a connection there?
Okay.
You see, Doc, you need to shed more light on bipolar. We have our own theories here, so we really need you here to just shed more light about it.
Okay, yes, I thank you, Nelly, for your question. I hear you. Okay. So they call themselves, when we talk about that, that elevated self-esteem or that exaggerated self-esteem, it doesn't mean that what they're saying is always true. Eh? Yes. So, for example, you have a bipolar person telling you that they are this powerful. Okay, yes, actually, you have some who will tell you, I'm actually a general commander, army, whatever. Yes. Then you're talking to somebody who is actually a bit tiny and frail, and but he believes he's so powerful, and has that mind. Or somebody can talk about how they feel like they've got these supernatural powers. They can speak to God and hear His voice audibly. They can do certain things. They believe they're so beautiful. Everybody, they've got everybody who is after, everyone is after them. Things like that. So it doesn't necessarily mean that the things they're saying is true. It's just the nature of the disease gives them that exaggerated self-importance. So it doesn't mean that they have a high IQ, indeed. It just means that they have that self-importance. But please don't get me wrong. I'm not saying they've got a low IQ. Whether somebody is highly intelligent or not, there's still a chance of getting bipolar mood disorder. Yeah.
Thank you so much for clearing that part. I was worried. I thought maybe they're actually that extreme to say they would actually know so much about life just in case. Yeah. Okay, great. So we're coming to the end of our show, and as we had earlier mentioned, we sincerely apologize for just starting late for today's show, but not to worry, we're going to have a part 2 of this show. And so today we're just trying to give you just the intro or just the source around what bipolar is all about, and focusing on mania, which is the high side of bipolar. And the past weeks we've talked about depression, we've talked about burnout at work. So we thought it would be great to also look at bipolar disorder, because these are things that we do not know. I, for one, came with my own theories of what I thought bipolar was, and thanking Doc here, she's been able to explain and clarify some of these situations. And so you might be someone out there who's suffering from bipolar, or maybe based on what she had explained, it kind of matches up with what you have been going through. We would encourage you to see a medical doctor who specializes in mental health. Have yourself checked, because this is something that can be controlled. There's medication that you can take for it. And also, should you have it, or maybe your parents have it, or if you're a parent, you could look out for it in your children in case your children have it. Already she has mentioned to say you can get it through genetics, you can get it by environmental or even biological. So these are things that we have to look out. And I know we have certain friends who could be bipolar, but the fact that we don't know that they're bipolar, we don't know how to handle them. So the sooner we know and identify what is wrong with somebody's mental health, the easier it is to diagnose these people. And so next week we'll even open up for questions, for more questions. If you have anything else to say, it would be great, and we'd love to hear from you. And would like to thank our sponsors for this show, which is Performance Insurance Brokers. And this is the 60 Days of Winnow, which is simply a mental health program that is focused on helping you deal with any mental health situations. And I would like to thank Dr. Lulembo for coming through to the show. And in case you have any other questions for her, please feel free to send them through to our Facebook inbox, and we'll be able to send them to her, so that when she comes next week, she'll be able to address them. From me, I've been your host, Tavo Joy Masie. Dr. Lembo, do you have any last words for our listeners?
No, thank you very much. The questions were interesting. Thank you. Yeah.
Okay, so we will see you next week on Friday at the same time, 4 p.m. Remember, your health matters to us, and with Performance Life Insurance, it doesn't just end at motor insurance. You also have other healthcare facilities that will be thrown back at you, which include cancer checkups, BP checkups, and so many more. And so if you want to learn more about Performance Life Insurance, please feel free to inbox us on Facebook or reach us out on the numbers that have been put up on Facebook too. We wish you an amazing weekend. Dr. Lulembo, Lembo, I wish you an amazing weekend too. And
Thank
we will
you.
see you next week, Friday. Thank you so much.
Thank you.
Dr. Lembo, you can feel free to leave because you are left as the host.